Time to get some answers to your medical questions. Joining me is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you once again for coming us.
You betcha. Good to see you.
Coming to see us. It's always good to see you, Dr. Soria. All right, first question. What is the best way to control a child's allergies?
Yeah, well, they're very, very common. A couple of tidbits about childhood allergies. If mom or dad has allergies, then your child is much more likely to have them. Also, your oldest child is the highest risk of having allergies, as well as boys more than girls. So just to kind of give you an idea as to who gets them. And they almost always start, if you're going to have allergies through life, they almost always start as a child. So what do you look for? Well, a lot of congestion, clear runny nose. Sometimes they're even too young to really tell, or your child is too young to tell really the difference. So if they're breathing through their mouth, or if they have dark circles underneath their eyes, that can certainly be indicative of an allergy rather than a virus or upper respiratory tract infection. So what do? Keep them out of the outside. If it's pollen season or allergy season, keep them indoors. Keep the windows shut. Keep the car windows closed. Keep that exposure to a minimum. Also, hydration. Make sure they drink plenty of fluids. That helps with the secretions. Nasal saline drops work real well to irrigate the nose. And if your child likes spicy foods, put a little dash of hot sauce on there. That helps thin the secretions.
Because it makes your nose run,
basically.
basically.
Exactly. It's that simple.
Okay, second question. What's the best way to treat swollen throat glands?
Yeah, well, unfortunately, there's really no quick fix for that because swollen glands are really lymph nodes. And so it depends on what the cause of the swollen glands are. So, for example, what they are is a defense mechanism. They generate antibodies to protect your body against infection. So three things typically will do it: a bacterial or viral infection, a autoimmune disorder like lupus or rheumatoid arthritis, and then less frequently cancer. So the treatment's going to depend on that. If you have a bacterial infection, then you're going to try antibiotics. Viral infections go away on their own. If you have an autoimmune disorder like lupus, then of course it's going to depend on the cause as to why your lymph nodes are swollen. And if you have cancer, well, unfortunately, it's going to require chemotherapy or radiation therapy.
All right, good stuff, Dr. Soria. I tell you this all the time, and I really mean it. I always feel like I'm so much smarter.
I'm glad
when
one
you
of you
leave
can. Right.
Glad one of us does. And if you have a question for Dr. Soria, so you can feel smarter, you can send it in by going to our website, WPTV.com, and clicking on the health link. Scroll down on the right-hand side, and you'll see a form to write in your question. Again, thank you so much for coming in,
You're
Dr.
welcome.
Soria, and we'll see you next week. We'll be right back after this.